So, welcome everyone for the roundtable conference panel discussion. And I'm Dr. Pravin, co-founder and orthodontist from India. And the company which I run is Toothsi. And I welcome all the eminent co-founder from the different companies. Julian from Zenyum, Friedrich, I think, Friedrich Widu, as well as Yago Grela from Impress, and Sanjay Pathak from 32 Watts for this panel discussion. And it is really a pleasure to share the screen with all of you and to discuss all the different methodologies what we are using in aligner treatment in the service industries. So let me start with the question. So who will be first taking the question? Julian, you will be there. That's fine.
Sure. Happy to start. Of course. Hit me.
Fine. So, Julian, like we heard a lot about zenyum across Asia Pacific, and I should congratulate you to taking the aligner business into a different, making it into a different model, and taking it to a different geopolitical area to dentists, and making it more popular in the people in Hong Kong, Singapore, Malaysia. I think you're present in like lots of cities. So I should really congratulate you to making the aligner mechanotherapy more and more popular. But my question to you is like, what you think about zenyum, the future of zenyum, and with the other players like the Smile Direct Club and Candid, their exit from the D2C philosophy. So what you think, what is your point of view in terms of the future of zenyum or future of any aligner company in the D2C segment?
Right. Thanks, Dr. Pravin, for the question. Look, I think certainly something that we have seen is that within the aligner space, whether you look into the United States, whether you look into Europe, or whether you look into Asia, what you see is a clear convergence onto a model that is eventually doctor supported. So within zenyum, what we have always done since the beginning is that we have said we want to build a model based on partnership, not based on war or based on disruption. We always were very strong advocates to build a company that, while we drive a lot of marketing, while we support the local dentists with a lot of the user experience, the way that zenyum works is that every zenyum patient goes to a local dentist. We have a partner network, close to 750 dentists, where essentially you get an in-person checkup done, you get x-rays done, which are very difficult to otherwise administrate, and you get a 3D scan and the dentist looking at you. So our philosophy has always been that this is absolutely crucial towards providing ethical and well-predicted treatment results. Now, what we have seen is that companies like the ones that you had mentioned are either changing their model towards that, right? And so you see a certain convergence, or at least starting to build out this kind of partnership model. I think overall, we do appreciate that, because we believe that only with this level of partnership, you can actually have the right results. And with that, you have happy customers, and that helps everyone within clear aligner treatment.
Okay. Just to take this question slightly one step ahead, I still want to know, like, what you think about the ownership of the zenyum customer. Like in your model, do you think there is ownership from the dentist? They treat zenyum patient as their own patient?
Yes, 100%. Matter of fact, in many markets, we are the first, or we are the main reason that a customer goes to a dentist for the first time in their lives. And so it becomes actually quite important that you have restorative measures, S&P, cleaning measures, all of that taken for customers, right? If you've never seen a dentist and you're in your mid-20s, right, you're going there for cosmetic reasons in a market like Vietnam, for instance, then it's actually quite crucial that the dentist sees that as their customer and prepares them for, let's say, a more cosmetic clear aligner treatment, also from a medical perspective. So our perspective is always that those customers eventually need to be managed fully by the local dentists. Yes.
Okay, great. That's a great insight, Julian. And you want to take the next question, or I can ask the other panelists?
However you like. You run this panel,
okay,
so
okay.
You decide.
Because then, fine. And just one more thing about the same, what the question I'd asked you, like for the Smile Direct Club or something, like, do you think the model which Smile Direct Club and Candid work, it will help the aligner industry, or it will not?
Look, I think one thing you're seeing is eventually quality, and for us internally, that means NPS, so Net Promoter Scores, which we're measuring how happy are the patients, the customers with the outcome, but also how happy are the dentists with the outcomes which we are providing. And I think what we have been able to create is a product that can compete with the best systems in the world, and as a matter of fact, in some markets, outpacing even some of the best systems in the world when it comes to satisfaction rates. I have a hard time understanding how to create that without dentists at all, right? There's a reason why doctors have the qualifications and the licenses and have studied for decades their profession, because for us, this is a safe way to administrate treatment. And for us, they will always be a part of that.
Great. Dr. Friedrich, I'm Dr. Pravin here, Orthodontist. So I would like to ask you to introduce yourself.
Thank you for inviting me, and thank you, Iago, for giving me the word. So my name is Widu. I'm an orthodontist. I graduated in 2001 from the University of Düsseldorf in the center of Germany, and then I founded my first office. Back in the days, I was doing a lot of invisible treatment. Obviously, it looked by then completely different. Align was just entering the market in 2001 in Germany. The product was not so well developed as it is today. We did a lot of lingual cases. Later, I did the lingual master in Paris. And after 2010, I did more and more aligners. I developed a technique that is a hybrid technique. I developed a bracket that works underneath the aligners, did a lot of cases in this hybrid technique, hold some patents, did some publications later on, was the first one to introduce dental monitoring in Germany. I saw in 2016 the enormous advantages of doing remote control. By then, this was heavily criticized. Then Corona came, everybody started to do it because they saw what great advantages that can have. And in 2020, I was approached by Smile to Impress by Vladimir, and I found the business concept tremendously interesting, and I see there a high potential in the way they do it. So in January, I'm proud to say that I joined Impress, and I founded 2 aligner-only clinics back already in 2017 that were completely orthodontic driven, and there we now have a partnership with Impress. And let's see what we can move in during the next years in Germany.
Great. So with this, I would like to ask, what is the success story of Impress? So I think the Impress has grown really fast in across Europe. So what do you think is the key to success of its exponential growth?
I can explain this extremely well to you, because in Germany we have 2 different market participants that have a complete different approach, and this is Dr. Smile and Plus Dental. Maybe you have heard of them. And Impress was born in 2019 to combine best orthodontic tradition with innovative technology, which means they're actually having their own specialists and their own clinics, control the process, and do something that is traditional. Aligner is pretty traditional already in 2001, but with a complete digital approach where the entire process is digitalized. The content of the information management is very well controlled, which a lot of offices they struggle with that. It leads also to very precise treatment plans as an alternative to braces. Aligners should be very efficient and safe. And it is a great customer service, which combines a 7 days a week approach that is possible via the app that Impress offers. It's not under monitoring anymore. It's the own Impress app. The patient can communicate, but obviously it's combined with a face-to-face visit in their own clinic. So I think this mix with the great customer care, where the patient is in the center, makes a huge difference.
Great. So, like, where are you present currently in Europe? Like in most of the cities?
Well, it is Spain where they started, Italy, France, now UK and Germany, Ukraine. Obviously, Ukraine is not so easy. So actually, all major markets are now covered, either mature or growing.
Okay, okay. And what do you think that USP of Impress, or you can see what means, how do you want to project Impress when you are going to sell the invisible orthodontics?
Well, first of all, they are complete experts in this field. They focus on that. We focus on that. And there are different developments, technological developments that come with that. First of all, it's obviously a great customer relationship management architecture behind it. Is the own app that has built-in artificial intelligence. Is the control of the entire process, because we have to deliver it then to the patient. And if you have a patient-centered, patient-focused care, then it is important that the clinic itself looks at these protocols and works with them properly. And I mean, in Germany, anyhow, customer care is pretty difficult to achieve at the 5-star level. So I'm very happy to have these protocols. I think in Asia, the approach is a bit easier because people tend to be extremely friendly and very, very focused on each other. Whenever I go to Asia, I can see that. Also, the design in the Impress clinics has a very warm and comfortable design. So it's a lot of things that come together as a unique selling proposition. Not to forget that also own production is now integrated with a great range of options. And not to forget that there is a team of technicians. So not only because Impress also works with other aligner producers, but their own technical team and own orthodontists are looking on the treatment plans. So that's a lot. We could talk about this 2 hours. I just wanted to emphasize a few aspects.
Great. So thank you, Friedrich, for the small insight. Let's discuss in bit details very soon. Now, the next, I would like to invite Sanjay Pathak from 32 Watts, India. Sanjay, you can just give a brief introduction about yourself.
Hi, good afternoon to everybody. My name is Sanjay Pathak. I'm basically a technology guy, though I'm a life science graduate. But I do a lot of work into medical technology, partnering with All India Institute of Medical Sciences. And I'm a serial entrepreneur. I have 2 companies. One of them is 32 Watts. The other one is called OsteoSkill, which is in IIT Delhi. Okay. So 32 Watts was conceptualized in 2017 between me, Rahul, Dr. Nidhi, and Dr. Varun. Dr. Varun is our chief orthodontist. And about me, I have been basically and primarily into 3D printing technology ever since 2016. So to my credit, there is a case of vertebral replacement, C2C3 replacement, second successful case in the world, which was done in India. First one is in Australia, and this was the second one, widely published. But because 3D printing is something where dentistry is the obvious choice, so we went towards the dentistry, and in dentistry there's aligners. Okay, so 2017 we started, and here we are today in 2022. We are, to my standards, we are doing extremely well, and but of course, sky is the only limit as far as the dental aligners are concerned. You know, Dr. Shetty, you and me both are there in this. Right?
Yeah. So, so we are from the same continent and same
market,
country.
same mark,
So,
same
market.
country, same market.
But I would like to still have your insight on what you think about the potential of the clear aligners or the demand of the clear aligners in Indian market.
See, Indian market is huge, Dr. Shetty and other colleagues of mine. You know, there are, if I only take the urban population in India is at 480 million people who are between 14 to 45 years of age. So we can say this is the addressable market. You know, for aligners, we are not necessarily saying that only teens. Okay, we can treat somebody who is 40, 45, 50, whatever. But primarily, if we say that, okay, if we take a market of 14 years to 45 years, the total people living in urban areas in this age group is 450 million people, out of which Dr. Shetty would agree with me, 85% people have malalignment, and out of which, say, roughly 50% of the people would need treatment.
Right.
So that makes you a TAM of 240 million people, which is kind of mind-boggling, you can say. And that's what is the total addressable market. Now, when I go to the braces, in India, we are doing about 200,000 braces every month. That makes it 2.4 million braces already, you know.
Yeah.
But this 2.4 million braces to a potential of 240 million is only 2%.
Right.
So what we are saying is, out of every 100 people who need orthodontic treatment, only 2 are being serviced.
Right. Right.
And then when it comes to aligners, out of the entire, the braces market, only conversion to aligners is in the range of, say, 3%.
Yeah,
maybe.
less than 3%.
3 or less than 3. So one can only imagine, you know, what kind of a potential market we are sitting in. We have our own challenges. Everybody knows that, but
Right.
less than 3%. And to my opinion, Dr. Shetty, this market should grow to, say, braces. If I say today is 2.4 million, it should next 5 years it should go to 4.8 millions, going by the current growth rate. You know? And out of which I envision some 10% people going for clear aligners. No, that will make it 500,000 cases of clear aligners. So that's how the whole thing is about. You know, so I'm being very conservative, but if people like you can drive it faster with the kind of money you are putting in, I'm sure, you know, it could be 1 million as well. You know?
Definitely. So it's all. It's like we are catalyst for each other, and we, like, whatever we do now, it's because of the globalization. We do, Impress is doing from in Europe, zenyum is doing in other part of the country, we are doing in India. So everyone is getting aware, and the market is getting developed everywhere now. Everywhere we are like propagating, helping, developing, marketing, motivating most of the customer. Okay, most of the patient to go for the clear aligners. So coming to Julian, for you, like, if I can ask, like, do you think that you need to change your business model to serve the dentist across 9 markets, because you are placed in a different continent of Asia? So is the customer sentiments or expectation is same in Singapore, in Hong Kong, in Malaysia, in Thailand, or you have like one mold fixed to all, or do you want to change for everything?
Right. It's a great question, right? So whenever you ask, obviously, our teams in the local markets, right, the people in Thailand will tell you, oh, Thailand is very different than, for instance, Hong Kong. I think one thing we nevertheless see is that the expectations from the customers are actually quite similar across the region. From a pure treatment planning perspective, I think there have even been papers that said between North Indian and South Indian patients, you need to slightly adjust your treatment planning. You would know much more about that. But what we're seeing is we cannot just take a Caucasian philosophy of treatment planning or European philosophy of treatment planning and just apply it to Southeast Asia or even to North Asia. So we do see some specificities around how we are adjusting our treatment plans, things like IPR versus expansion guidances that we're giving are different depending on the markets we find ourselves in. The other thing that is different is the overall regulatory landscape. We always said in the beginning we play very white with zenyum, so always ensuring that we have the right licenses in place. We don't start a market before we haven't gotten full clearance from the local authorities, and so that sometimes takes some time if you do such a fragmented play as ours. But we also think it's very important to make sure that the overall reputation of the category stays intact. And then you have the dentists, and I think what we're seeing there is, there are differences between the markets. There's obviously different schools of thoughts in education, but we even see that, I don't know, whether you went to one university or to a different university, you already sometimes see differences in treatment philosophies. You certainly have that between countries as well. And then it depends how, let's say, mature the category is already. So in a market like Singapore, for instance, you would find that similar to what Dr. Friedrich might see in Germany, right? Like you have a dentist since your early days and your young years that you go to, whereas in other markets, what I mentioned before, it's literally the first time a customer sees it, and so we need to calibrate our solution towards all of these specificities.
Fine. So it's like my question is for Friedrich also. It's the same question. Like both the people, like one in the south, what you say, the eastern part, and you are in the western part, and same. What do you feel about the acceptance from the dentist? Like why? What is the reason for the good reception of your service in so many places, Friedrich?
So you mean from a patient perspective, or why the doctor accepts it?
Yeah, the doctors as well as patients.
Well, there is a lot of advantages in aligner treatment. No, first of all, for the patient, it is hygienic, it is invisible, it is removable, it doesn't interfere with your life. You can eat whatever you want. The technique has become more and more efficient. It is great to inform the patient with the digital options that you have, show him the result before. I mean, you know, all these things, the motivation of the patient, you show him the different stages so he can keep track. With the app, he sees how he is improving. So braces is a thing that actually, if I think in any country, if there would be no price difference or aligners would be cheaper, and obviously if you're eligible patients that are starting from 14, so thanks to what has been commented here before, I see it exactly like this. It starts at 14 in puberty. They would probably all go for aligner. So that's regarding patients. Now, regarding doctors, if you have an affinity for digital, it is a fascinating technology, and it is something you can now treat many cases with because it became more efficient. If you want to do high-end dentistry, you just need ortho or an orthodontic specialist or somebody who brings these services to you. Think about doing veneers, think about doing implants, think about post-paro treatment. And with the education of the population, the demand grows. So that's actually a good thing that the industry did. Also, Dr. Smile, I mean, it's not my favorite company with that business model, but I have to admit that they educated the market, and now you see that the number of cases grows constantly. Even in Germany, which is a very saturated market, we have our dentists and we had orthodontic treatment, but then the second and third orthodontic treatment comes maybe as an adult. And I see the potential in India, for example, where you see it as well. It's unbelievably what will come during the next years. So it's great to have that technology.
Yeah, so we should. I think the technology is the main reason to connect everyone together. So be it telecommunication or be it 3D printing or be it any virtual setup, because of the technology, we are all here now on the same platform. But if you ask me, like what I had seen over the period of time in India, how the thing has been evolved, like definitely we take most of the inspiration from the Western countries, like from the Europe and from US. And our market may, as Sanjay has already mentioned, it's a huge market. It's really a huge market, but then it's still a very immature market. It's not like highly motivated, highly educated people from European countries or Western countries, where most of the people, the patients, they're undergone at some point some treatment, and they give that, the government give that much of importance to the oral care. In India, still the importance to the oral care is absolutely less. The spend on our oral care by the government is less, so which is increasing over the period of time. But as we, like, because of the revolution in the technology, we are trying to market, we are trying to propagate the importance of oral care, the importance of malocclusion, how to get it correct. Because in India, if you see, the population is big, the number of cases, as Sanjay has mentioned, like near about 98% of cases, still people do it with braces. It's only less than 2% of cases which has been done by aligners. And there might be like 70% of population, they are not done any orthodontic consultation till the age of 35 years. So this is the big group of people which are uninformed about aligners. So for us in India, the challenge is not only treating, the challenge is to inform, to educate, to motivate the patient. Because our is like most in India, it is like we need to be a brand creator right now. So we need to create new population for aligners. It's not like everyone is informed. So that's one disadvantage for us. Maybe a huge population, huge number of people, but it is very uninformed, not educated. Nobody knows about it. So we, over the period of time, like from last 1-2 years, we are doing too much of advertisement, promotion, propagation, everything to make understand what aligners are and what aligners can do. So that's what we are struggling in India. So challenges, it's very exciting, the journey, but it's very challenging journey. Sanjay, like for you, what according to you, like what do you think are other challenges for the Indian aligner market?
See, Dr. Shetty, as you already said, the biggest challenge for us is the awareness first. No, the awareness not only amongst the patient, awareness even at the BDS level.
Right.
No, whom will the patient report first in India? Even if he decides to go and the patient recognizes, okay, I have some malocclusion, I have some crowding or space or something, at best they will go to their local dentist. And even the local dentist, what they do is the first thing that they will do is, okay, boss, we'll give you braces. Okay. And then the orthodontist will come and he will also second the same thing. Most cases, most means more than 90%, I'm saying. So challenge is awareness with the patient, awareness on the effectiveness of this treatment with the dentist, awareness and believe in this system with most of the orthodontists. Till we have 14,000 of them now in India, I guess.
Yeah.
And 14,000 people are not using aligners, right? Otherwise, the number would not be so dismal.
It's only the top 1 or 2%.
Yeah, that's what, India typically, as Dr. Shetty clearly said, see, out of whatever number of people we have, bunch of that 1.5 billion people, only around 5% people are the ones who get the proper medical treatment, unfortunately. And in dentistry, it will not be even 5%, because this is one ignored field. People do not know that there is an infection in the mouth, and there is a chronic infection in the mouth. It can result into heart disease. You ask 100 people, only one will know. Most of the people who have heart attack are checked for their oral hygiene first. But how many people know this? So awareness amongst the patient, awareness among the dentist, awareness amongst the even orthodontist, and then the service and the involvement of doctors association. Then we have price challenge. Challenges are too many. So, but primarily I will say awareness, serviceability, association of the doctors, and the price challenge. These four, basically.
Yeah. So now for all the panelists here, my question is like, what do you think in this ecosystem of aligners? How important is the role of orthodontist? Like for zenyum, for Impress, for 32 watts, as well as for Toothsi. What is the importance of orthodontist in the entire ecosystem?
So maybe I can start with that.
Yeah.
I think one of the certain technical advances of clear aligner treatment is that GPs, so that dentists, can now, with the right training and kind of the right dedication and the right knowledge, do orthodontic treatment, right? So that is one of the big revolutions of our time that we are seeing in the space. We nevertheless see that, especially for more complex cases and movements, if we just think about partner dentists, we have a system called Zenyum Clear Plus, which works with attachments, with elastics, with distalization, that those kind of cases typically sit better with orthodontists than, let's say, with a GP. Now, within the treatment planning setup that we have within Zenyum, I think it's very, very important that you have a high level of experience. So we have a team that probably here in our part of the world has seen the most clear aligner cases of all of the orthodontists and dentists around us, just by sheer scale, and therefore know how to effect safe movements and treatment there. So for us, in short, to answer, it is absolutely essential for us to have that right knowledge.
Yeah, over to you, Friedrich.
Yeah, Julian, thanks for this introduction. I completely agree, and I would like to add something. The problem is the assessment. And I have worked in my life with partner offices while I was not with Impress, and now being with Impress. I get to the same conclusion. It's great if you discuss cases, and we do that at Impress at the level of orthodontists, and also the technicians are involved and discuss the digital treatment planning. The entire process is digitalized. And then you get to following conclusion. It's not only where the teeth stand, it's the eligibility of the case. It's sometimes a border to surgical case. Sometimes you have to access very precisely the bone level. Sometimes you need 3D radiology. And then you get to the conclusion that an easy case is actually not that easy. And that maybe the wishes that the patient has on top are specific, like lip closure, or they want to change something about their profile. If you take all this into account, I highly believe that today we do not have a complete artificial intelligence who can get to the conclusion how to treat the case. And as long as we do not have that, this assessment is actually not so easy. So what my point of critics is that I think that without screening all cases and having an orthodontist in the team, sometimes the dentist just doesn't know what to do. And a lot of times I'm being asked, is that treatable? Is it a complex case, or is it actually not complex? Can it be treated with a so-called light case? Like this terminology comes from line technology. And what I think is fundamental at Impress is that exactly this screening happens, and orthodontists look at every case that is uploaded, and they do not leave their dentists that they have a learning curve alone. And that is also a full control in the partner offices, and I think that is crucial for treatment quality. So you need the orthodontist actually in this process completely integrated.
Yes, because I myself being an orthodontist, I understand like as Friedrich, you told that our most of the orthodontists, like my journey also started from invisible orthodontics. So I have a patented product by the name of Lingual Matrix, which is a lingual orthodontic system in India. And then from the lingual, we shifted into the aligners. But definitely what I had seen, the people confused or people mistaken aligner, like it's a very simple, just it's an take the impression, scan, make an aligners, give it, everything is done. Yes, there are certain percentage of cases where we can do all these things. But majority of cases, if you want to grow wide, definitely the expertise in planning, diagnosis, treatment planning, the management of the system is everything. Deeper understanding is needed. No matter whether it's a dentist or an orthodontist, any person, any expert who can do all these things, he's the best driver for the aligner treatment. So it is safe in the hand of dentist, provided he understands all the mechanics, or it's safe in the hand of orthodontist also, if he knows how to manage, how to monitor the case. So in my company also, it's very important that all the treatment planning, everything, it happens through the orthodontist, and it goes out, and any discussion is there, it's always with the orthodontist. So we have the team which we discuss, we brainstorm, we make understand that this is the diagnosis, this is the treatment plan, and this is what you need to do. Certain cases, yes, we can do it, but majority of cases, you need good support of an orthodontist, and there is a definitely orthodontist plays a major role in entire treatment planning and monitoring.
He genuinely always believed that no treatment plan should ever be done without the full involvement of an orthodontist. Because orthodontist is the person who understands the tooth movement, tooth rotation, and whatever movements are required. And also he understands that which patient will need a radiological examination also, where you need an OPG, where you need an X-ray. So we have a large team of orthodontists, and each and every case goes through them. So as far as the treatment planning is concerned, there's 100% conviction that orthodontist has to be involved in the treatment planning as such. Now, when it comes to treatment delivery, then the problem is, see, for example, like in case of Julian in Singapore, most of the BDS doctors are trained into certain amount of orthodontics. But we cannot say the same thing here in India as well. So here at the level of delivery also, I think the first IPR attachment and all that stuff should be done by the orthodontist. Then probably, every 3 months, 6 months, they can have a look, and review should be there. We should have a system where, the orthodontist is being supplied those photos be done by them, Patient can visit a GP, that's fine. But the regular monitoring has to be done. And how many times it slips, in orthodontist, if the patient didn't wear the aligner for say 10 hours, the whole story goes back. You ask him to go to the previous aligner. So importance of orthodontic not be sub-optimized. At this moment, we cannot say that whatever amount of AI, I don't know how the Invisalign does it with the help of technician, but we can't. I'm sorry. I mean, we have to have orthodontist almost.
And then we all agree, orthodontist. We all agree that orthodontist will play a major key role in aligner mechanotherapy, right?
Yeah,
so
absolutely.
Will be a heart and soul of aligner mechanotherapy.
Yeah, absolutely.
I think there is
Absolutely.
no
So
doubt,
far, yes.
and we all will all agree for this.
And maybe when we have done, say, 3 million cases between you and me, then we can have that thing, which can possibly decide.
Fine, fine. So, Julian, to you, like what you see in the future, how you want to evolve yourself?
So I think for us, I couldn't agree more, by the way, with Dr. Friedrich said about a case selection in the beginning, right? It's very important that you only touch cases that you feel confident in taking. And so for us, what we always built is a very big difference and kind of Chinese walls between the business side, which always wants to grow, right? Take more cases and be more aggressive. And our dentists and orthodontists who are owning the solution, and they are the ones that are selecting or making sure that from a case selection perspective, we are always playing it safe. And so I think what has been great for us is last year we launched a new system called Zenyum Clear Plus, what I mentioned before, that just is getting up to par with the best systems out there in the world. And I think that is definitely for us the direction we want to take the company to, where we say that we believe that a large percentage of overall cases can be treated with clear aligners if you have the right system, the right treatment planning, and capable dentists. And our goal overall is to further increase those capabilities of the system. And quite frankly speaking, the most recent adoption rates and the most recent outcomes are telling us that we are very much on the right way there. So very happy about that.
Yeah, thanks. What about you, Friedrich? What you think, like how Impress wants to evolve in the near future?
Well, actually, they have already shown how fast they can evolve, and it's going to go exactly on that path. Because frankly speaking, the market competitors in Europe do not have such a consistent model where everything is under control, closely monitored, assessed treatment plan, as I said, and final delivery of these great services to the customer in their own offices to have a great customer experience. So as I said, it's more like only direct to consumer sales of aligners, and there I think is a huge potential to grow, especially in Germany. They expect a higher level of services. So either you go to the orthodontist directly, maybe there you cannot have a complete offer with all the digital control of the processes, payment plans, and so on. So we have a different customer experience that we create, and I think there's a huge market for it to get a very professional medical service in a nice environment with all the digital advantages, the monitoring, the communication, and so on.
Okay, and then how you are using technology, like for your business model? Are you using any good amount of technology for your business model?
Well, let's take one example, and that is the remote control. I think that remote control without the option to go to the office is not a good solution, because you never know. It's about trust as well, and sometimes, as you all know, the patient just needs a reassurance. So we are there if he needs us. But in between, it's a great advantage to have that. So you have access on Saturdays or Sundays, and you just have to post the picture there, and it will be assessed, which also gives you security and speeds up the treatment. And whenever we need and we see that something's going wrong, we can interfere. So Impress has its own app for that is constantly improving. And, all this is connected to the treatment planning as well. So there is an evolvement. It's not static. It's getting better. And this is an example for where the technology drives us, but with the implementation of the doctor and the relation to the patient, not standing alone.
So, Julian, like for you, what I need to also ask, like you are involved with so many dentists across. So is there any training program for all the dentists across, and how well these people accept the training program? Is there any rigidity from their side?
Yeah, so what you have with other providers oftentimes is that they actually charge for those training programs. And I think what the team has built here over the last couple of years is very impressive, because we are nowadays running dental training programs, for instance, training about the details of the biomechanics of clear aligners and similar topics, together even with the dental associations in markets like Singapore. And so through these strong partnerships, we have been able to drive kind of knowledge on the clear aligner topic within the markets that we're in. But also obviously make sure that through dentists and orthodontists overall being more comfortable around those solutions, you see better outcomes. Now, we are offering these courses for free to our partner dentists. And as mentioned, when we partner with the local associations, we're also trying to get big names in and make sure that we share knowledge and give back to the community from that perspective a little bit. Now, this depends again market by market overall, but it's a very important part of us building a strong knowledge base community in the clear aligner space here in Southeast Asia.
Okay, so do you do conduct like only the theoretical courses, or there will be a hands-on for all these dentists? So that
great question. Would love to fly everyone in. This is still very difficult in times of COVID. I don't know how the situation is there in India, but this is something that we will start doing, especially when now the big dental fairs like IDEM are coming back in markets like Singapore. For now, most of that, unfortunately, is still virtual because you just cannot get big congregations together.
Yeah. What about you, Friedrich? Like you with Impress, there is a proper training program for all the dentists who comes on board with you?
Well, obviously there is an ongoing permanent training that is in virtual meetings. So we have a weekly virtual meeting and everybody has an onboarding process so we can assure inside our group the quality. Regarding patient care as well. So I think it's all about communication at the end of the day. And of course, it's nice to meet. And I've been already several times to Barcelona as well as Impress coming to Germany. But in these times, I agree with COVID, you need these digital platforms as we do now to communicate. Yeah. And we transfer the information constantly, and it's there's so many news every week that come to improve the process. I mean, don't imagine it's all the time a complete new app, but in the usage of every day, there are small steps to improve, as you all know. And this, if you really want to be on the top of your game, it's exactly what you need to constantly improve. And training of the people is one major part of it.
Yeah. And is there any protocol for you if there is any issues in between with the dentist, some troubleshooting, something? So you handhold people or the treatment planning or the treatment progress?
To be honest to you, I have never seen a more structured unit as Impress in ortho. And I've seen a lot in the last 20 years. So there are a huge amount of protocols for troubleshooting. I mean, the whole system has about 1,000 different tickets that you can elaborate on in a huge customer relationship management tool. So that's exactly where I think orthodontic offices have major deficits. You know, somebody calls the reception doesn't really understand what's going on. Reception gives some kind of information to the doctor who has maybe a complete different picture than the reality. You know, and that happens actually not only in ortho offices, it happens in any kind of office. And then at a certain point you call back, but you don't reach anybody. And when I look at Impress and the way they handle these things, and whenever something goes wrong, it has a loop, a feedback into the system, and that's how I see how you can only reach top level and stay there. It's exactly what they live, is a continuous improvement process.
Great. And what about you, Julian? Like, won't it be very difficult for across the continent to troubleshoot with a different countries, different dentists?
I think that's exactly what you use technology for. So look, my background comes from tech eventually, and I like fragmented markets in place. And to create those predictive results, you need to have these CRM systems that Dr. Friedrich was just alluding to make sure right customer shows up at the clinic at the right point in time, has all of the right data uploaded for themselves in the backend, and that only works with proprietary software systems. So zenyum has invested quite a bit in making sure that we are reducing as much friction as possible for the customer and our partner dentists when using these systems, whether it comes to the administrative part of the clinic of just uploading the files, or the treatment planning process, where whether you're on a phone, on an iPad, or on a laptop computer, wherever you are in Asia, you can actually give your comments on your customers. And afterwards, for the patients that are under treatment, we have developed proprietary app that helps the local dentists to make sure that the customer is going through the journey without any issues, and that there's immediate support should any problems ever potentially come up.
Okay. So coming to the last question, I think to everyone, it's what do you think, like with the current clear aligner, what you see, the boom, or clear aligner like present everywhere, what do you think about the future? Is it something more than clear aligner, or this is the best? Yeah,
I can be very short on that. So first of all, it's going to be more clear aligners in the future. And second, what I strongly believe, ortho will be more digitalized. That's also clear, because it's prone to that. And third is, I strongly believe that hybrid technique will evolve, because there is a need for it. Why should you put braces from 7 to 7? And why should you do it for 1.5 years if you combine and do the pre-leveling and then you go to aligners? And Impress already now, I cannot tell you too much about it, does some heavy work on it to have a broader spectrum of high-end ortho that is offered, even more than average would do now today, from diagnosis to treatment. But I think these are the aspects, and at least for the near future, I think it's going to be extremely interesting over the next 5 years how this market is going to develop. And of course, Asia and India even more.
Yeah. See, it's like the accelerated orthodontics, it's a bit of debatable. Like there is a laser accelerated as well as surgical assisted or vibration assisted. So it's a bit debatable. In few of the cases documented, published across the journals, in the review of literature shows that it work. Sometimes it does not work. So there is no clear-cut mandate that yes, by doing this, we had decreased the timeline. But in some of the sample size, it has shown by using that accelerated orthodontics, the timeline has came down significantly, at least by 30-40%. Now, this also depends on the compliance of the patient, how well they are using, right? Whether they are so particular in using. And what I feel as an orthodontist, we can't load our patient with so many things. They need to put aligner, they need to remove aligners, they need to use this accel-dent, they need to use the vibrator. Nobody can do a job of getting corrected 24/7 by performing all this act. It's very difficult and too much to ask from our patient that use this, wear it, clean it, brush it, accelerate. It's too much. So definitely science will evolve. There will be something will come over the period of time where there is a less amount of compliance is needed, because more the compliance, nobody is going to get the solution out of it.